Did you know you might be paying for a doctor's visit or test that should be free? Here's what most people don't realize. Your insurance plan already includes free preventative services many people never use. When you skip them, you literally leaving money on the table. Every year, many Americans pay for tests and visits that should have been covered fully if they have known the rules. In this module, I'll show you which preventative services are free, why plans cover them, and how to avoid surprise bills for care that should have been free. All right, the agenda for this module, the law behind $0 preventative care. Common examples of $0 preventative services. The catch, billing codes, how to confirm beforehand, don't miss employer perks, extra ways to stretch your benefits, common pitfalls that causes bills, pro tip roundup, example, the free visit that wasn't, closing, and next step. Do you know if your plan is HCA compliant and non grandfathered? Before your next visit, how will you confirm it's coded as preventative and done in network? The law behind the $0 preventative care. Let's start with the why. Under federal law as of this recording, specifically the Affordable Care Act, ACA, most ACA compliant non grandfathered health plans must cover a set of in network preventative services at $0 cost share. No deductibles, no copay, no insurance. As long as the service is preventative and done by an in network provider, your share is zero. Now, here's an example. Emily scheduled her yearly preventative visit. It was billed correctly, so she paid $0. Her coworker skipped prevention. Later, the same labs were done to evaluate new symptoms, a diagnostic reason, so she owed about $240. Why plans do this? Catching problems early costs less for you and the plan. Now, did you know since the ACA took effect, tens of millions of people have used $0 preventative vaccines and screening each year? $0 doesn't mean optional. It means you already paid for it with your premium, so use it. Which of these $0 services are you due for this year? Are your providers and the lab imaging sites in network for these services? Common example for $0 preventative services. What's actually $0 when in network and billed as preventative? Here are some examples. For adults, annual prevention and wellness visits not the same as problem-focused physicals. Screening as recommended for your age, risk, blood pressure, cholesterol, diabetes, colorectal cancers, cervical cancer, and breast cancers. For adults, vaccines recommended influenza, COVID-19, Tdap, shingles, to name a few. Behavioral screenings, such as counseling for depression screening, unhealthy alcohol use, brief counseling, tobacco cessation, counseling, and meds. For women, plan age, risk, dependence, contraceptive counseling, and FDA-approved contraceptives with limited religious exemptions. Also for women, breast and cervical cancer screenings, prenatal screenings, and counseling. Now for children and teens, well child visits, immunization, developmental vision and hearing screenings per age. Now here's an example. Renee got a flu shot, shingles vaccine, cholesterol check, and screening mammogram, all in the same week, all $0 in network. That's how prevention is supposed to work. Here's a pro tip. Find the full list on healthcare.gov or your plan's preventative benefit page. Look for age, interval, and risk notes. Now, did you know these lists are updated periodically as guidelines evolve? Check your plan's page at least once a year, often around renewal and open enrollment. Make prevention visits part of your yearly routine. At your next appointment, how would you separate preventative items from problem focused concerns? What exact phrases will you use to confirm preventative billing? The catch: billing codes. $0 only applies for services as billed as preventative. If it's billed as diagnosis, your normal cost share can apply. Example 1: an annual visit turns into a charge. You book a $0 preventative visit. Mid visit, you bring up a new knee pain. Your doctor orders an x ray for that new problem. That image is diagnosis, so you'll likely pay your plan's cost share for the x ray. Example 2: lab test. A cholesterol panel ordered for a routine screening is $0. If the same test is ordered to evaluate known disease or symptoms, is diagnosis. Cost share may apply. Now, here's a pro tip. When scheduling, say I'm coming in for my annual preventative wellness visit. Please ensure it's billed as preventative. Write that on your intake form as well. Now, did you know billing systems use CPT, HCPCS codes, and company diagnosis codes? Those codes drive coverage. A single code can flip a visit from covered to costly. Be clear about your purpose. Routine preventative checkup versus problem visit makes a big difference on the bill. Who will you call first, the clinic or your insurer? And what will you ask them to confirm? Where will you know the rep's name and timestamp for your records? How to confirm beforehand. You can avoid most surprise bills with a few quick checks. Step number 1: call the clinic. Say, will this appointment be billed as preventative, not diagnostic? 2: call your insurer. Say, is this service covered under my preventative benefits if performed in network? Step 3: confirm in network status. $0 preventative coverage applies when the provider and facility lab are in network. Now, here's an example. Kevin's blood pressure screening at his in network clinic was $0. His spouse used an out of network urgent care for the same screening, a $95 bill. Now, here's a pro tip: write down the date and time and the name of anyone you spoke with. If a bill appears, those notes helps resolve it fast. Now, did you know insurers document your calls? Quoting the rep's name and the timestamp speeds up corrections. 5 minutes of confirmation can save weeks of billing frustration. What wellness perks or reimbursement does your employer offer that you haven't used? Which one could you claim this quarter? Don't miss employer perks. If you have job-based coverage, your employer may offer extra preventative perks: on-site or sponsored screening, blood pressure, glucose, lipids, fitness or wellness reimbursement, gym, step challenges, weight management, telehealth check-ins for coaching and preventative counseling, employee assistance programs, EAPs, for mental health, stress, legal, and financial counseling, usually free and short term. Now, here's an example. Carlos learned his company reimbursed $200 per year for gym memberships, with receipts twice a year. He's been paying full price for years. Now he gets money back. Now, here's a pro tip: check your HR benefits portal at open enrollment. Wellness incentives often reset annually. Now, did you know employer wellness programs are common, but participation rates are often low, meaning many people miss out on free money tied to preventative activities? Preventative benefits don't stop at the doctor's office. Some are hiding in your workplace. When is your annual trigger? Your birthday month, back to school, New Year's, to schedule prevention. Which items can you bundle into one free visit? Extra ways to stretch your benefits. Make prevention friction free. Bundle appointments. Ask if your vaccine, screening labs, and preventative visits can be done together. One trip, $0 for the preventative parts. Use a yearly trigger, your birthday month, to schedule your preventative visits and vaccines. Keep copies or portal downloads for your preventative records for school or work incentives. Track age-based screening. For example, most people now start colorectal screening at 45, and many plans cover screening mammograms starting at 40. Following current recommendations, confirm timing with your clinician and plan. Now, here's an example. Jenny scheduled her preventative visits and vaccines every birthday month. She saves 2 trips, gas, and time off work. Prevention is easiest when it's part of your routine, not an extra chore. Which pitfall has tripped you up before? Mixed visit, out-of-network labs, or not checking results? What will you do next time differently? Common pitfalls that cause bills. Watch out for these. Mixing preventative and problem care in one visit. Keep the $0 preventative visit focused on prevention. Book a separate appointment for new issues. Out-of-network labs or imaging. Even if your clinician is in network, the lab or imaging site might not be. Assuming no news is good news. Check your portal and follow up on results. Missed follow-ups can turn small issues into big ones. Here's an example. Liam mentioned chest discomfort during his preventative visit. The clinic added a EKG, which converted part of his visit to diagnosis and cost him $180. Now he books preventative and problem visits separately. $0 prevention stays $0 when coded and scheduled correctly. Which 2 actions will you take this week to lock in on $0 prevention? Confirm codes, verify networks, schedule a visit. Where will you save your notes and EOBs for easy reference? Pro tip roundup. Smart ways to use $0 preventative care. 1. Most ACA compliant plans cover many in-network preventative services at $0. 2. It's only $0 if it's billed preventative. Watch the coding. 3. Confirm details with both the clinic and the insurer before your visit. 4. Always go in-network, provider and lab imaging. 5. Check your employer perks for wellness rewards. 6. Bundle preventative tasks and scheduling annually. You're paying premiums. Make the preventative benefits work for you. How will you prevent your preventative visit from turning diagnosis mid-appointment? What phrases will you use to check in to confirm $0 preventative billing? The free visit that wasn't. Rachel scheduled a $0 preventative physical during the visit. She mentioned knee pain. The clinic added an exam, an x-ray. 2 weeks later, a bill arrived that was $260. The office explained that the visit was part preventative, part diagnosis, so the cost share applied to the diagnosis portion. Next time, she booked 2 appointments. Preventative one day, knee evaluation the next. Her preventative bill went back to $0. Now, did you know clinics aren't trying to trick you, but they must code accurately? Understanding this helps you plan smarter visits. One question, will this count as preventative? Can be the difference between $0 and surprise bill. Which preventative service will you schedule today? And what date will you pick? What's your checklist? Confirm preventative coding, verify in-network provider and lab, note reps' names and times. You're already paying for these benefits each month. Don't leave them unused. Now you know what preventative care your insurance must cover at $0, how to confirm coding and in network details, and how to leverage workplace wellness perks. Next, we'll cover how preventative care fits your life, scheduling strategies, overcoming common barriers, and actually following through on healthy intentions. I will see you in the next module. Thanks for watching.